Hello, I'm Dr. Nitesh Patel, a GP working here at 21D, and today I want to talk to you about something that sounds really boring, but I can only promise it isn't. It's actually cholesterol. Now don't worry, it's not another lecture about just eating salads or anything like that. I want to talk a little bit about what it does, the positives, the negatives of cholesterol, and then just kind of wrap up to say a little bit more about it. What is cholesterol anyway? Now, cholesterol is a substance that your body makes to help a whole bunch of things happen. It helps with some of your hormones. It helps actually make some vitamins like vitamin D as well. It actually helps your body just function as good as it possibly can. The problem with cholesterol is when you have too much of it. It's like pouring cooking oil into some pipes. Essentially, it just clogs up and then you eventually need something to help declog it. Now, you will have heard of good and bad cholesterol, I'm sure. The good cholesterol is called HDL. And that's like a little cleaner, really, that goes through your blood vessels and takes away some of the cholesterol that's actually just deposited in those blood vessels. So that's really good. We want as much good cholesterol, as much HDL as we possibly can. The bad guy. The bad guy is LDL. Now, that actually does the opposite and puts the cholesterol down where we don't want it. And so we want as little of that as possible. Now, it's not easy for us to differentiate what's good and what's bad in food. But when you have a blood test or your annual health check or your over 40s health check with your doctor, they have a look at different levels and your different levels of good and bad cholesterol. And then they can talk to you about what's best and how things need to be changed, if at all they do. There's another fatty substance in the blood called triglycerides. Now, I'm not going to touch too much on that today, but that's also something that we want to keep fairly low. Again, it's important for similar things to what cholesterol is, but we do want to try and keep it down because that can also cause similar problems to the bad cholesterol. Why should you care about your cholesterol? Now, I touched on it earlier, it can clog up your blood vessels. Now, clogging up blood vessels can cause things like heart attacks and strokes, which obviously we don't want. So we need to work out how to try and keep it as low as possible, but still within a healthy range that our body needs. The thing is, you'll never know whether your cholesterol's high or low. It's not like suddenly you wake up this morning and say, "Ooh, I feel like my cholesterol's high today." You just won't know. And so that's why it's important to get it tested, particularly as you get older, because unfortunately, risks of heart attacks and strokes naturally get higher as you get older. There is a genetic component, and that can be called familial hypercholesterolemia. It's a really fancy term for saying family, high cholesterol. We like using fancy terms, it makes us sound clever. It all breaks down to very basics. Now, I suppose the part, what can you do? This is the lecture. Now, I try not to make it a lecture, but it's all very boring stuff. Because, I'm not telling you to eat a salad every day. I certainly don't. But reducing some of the foods that have high cholesterol. Now, this is a lot of fatty foods and significant amounts of dairy, cheese in particular. They can all cause increased cholesterol. There are certain foods that market themselves as lowering your cholesterol or being good for your cholesterol. Now, I'm not saying they're all bad, but it's worth doing your research because they're not always as helpful as they seem. Another thing, exercise. Now, I'm not asking you to run marathons. I've never run one, probably never will, but just going for a walk, a brisk walk, just increasing your heart rate up to above what it normally is will help. And doing that for about 150 minutes a week just helps lower your cholesterol, will improve your fitness overall, and will actually help make you feel better. Now, on to the two things that we know just ruins our health. Smoking and alcohol. They also increase your cholesterol. So if you're able to cut down on either, both, that would be brilliant. Now, I've had many patients come up to me and say, you know, I've done everything I can for my lifestyle, and there's no way I can improve it at all because they've already made a lot of the changes that we've spoken about. They're fit and active, they eat a healthy, balanced diet, and so there are medications that can help. Statins are the most common medication and actually the best medication at the moment for lowering cholesterol. Statins get a bad rep, and that's because the older statins caused a few side effects. Now, the newer statins actually cause fewer side effects and have actually been shown to be very good at lowering cholesterol. Now, one of the side effects that people talk about are muscle aches. Now, again, I've had patients say to me, look, I get muscle aches all the time. How do I know that these are any different? But you will know they will feel completely different to your usual aches and pains. And if you do ever get anything like that when taking statins, we'd say stop them straight away and just speak to your GP. I just wanted to end this one with a few myths about cholesterol. And one of them is, I'm skinny. My cholesterol's got to be good. Now, that's not actually true. You can have high cholesterol and be of any size. You can have normal cholesterol and be of any size. So it doesn't really correlate with one means the other. I feel fine. I don't need to worry. Again, you're never going to wake up and say, I have high cholesterol. Like you're very rarely going to wake up and say, I have high blood pressure. You just never know about these things. And so it's always worth getting tested. The last thing, eggs. Eggs get a bad rap with these things. And, you know, everything in moderation. Eggs in moderation, great source of protein. And yes, they do have some cholesterol in, but so do a lot of foods. And a lot of the cholesterol they have is actually healthy cholesterol. So I would say eggs in moderation are brilliant and don't necessarily cause a raise in bad cholesterol. Well, thank you for listening today in this talk about cholesterol. I hope it's been helpful and I hope it's not been too boring for you. Thank you.